Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, you can't turn on a TV or listen to the candidates on television and not have them talk about health care. It's emerged as one of the biggest issues in the presidential campaign, and we're going to continue the discussion about health care on Pennsylvania, and then we'll have our popular financial literacy update, all of that after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Before I get into it, I want to thank, as always, all of our viewers, and especially our viewers on WGAL in the Susquehanna Valley, where we are #1 in our time spot. It's all because of you, not us, you, and we thank you. All right, we're going to get into this. You know, we do a lot of health care programs. We're going to talk about preventative care, a little different aspect of preventative care. And joining me to get into that subject is Deborah Donovan. She's the Director of Provider Quality Performance Management at Highmark. And Dr. Michael Madden, he's the Medical Director in the Quality and Medical Performance Management Department of Highmark. And Dr. Greg Caputo, he's a doctor, he's the Chief Quality Officer at Penn State's Hershey Medical Center. Ladies, gentlemen, welcome. You know, with all these titles, I feel at home. It's like I'm out of college, you know, we all have these titles. But look, we are going to talk about something that I think is pretty important. On this program, we've done stuff about, you know, a doctor, their patient. Let's get into preventative care. What do you eat? Be healthy. Do exercise. But you folks have a little something different on preventative care that you want to talk about. And I think this is a pretty important subject. So let's, Dr. Madden, let me start with you. Talk about preventative care once you access the medical system. Talk about that.
I think that's a very important topic. There's a lot in the news about the quality of health care that's being provided and the complications that can come with when people get surgical procedures or interventions by health care. Yeah. What this program really does is address both being sure patients get the right care every time, as well as being sure that nothing bad happens to them in the course of getting that care. Mm-hmm.
Deborah, let me ask you this question. Do most Americans, I mean, what is your assessment of what you think it is like now when you enter the system for the kind of preventative care that I mean, this has now become a very important issue for physicians, and I want to ask Dr. Caputo in a moment, for hospitals. Am I right about that?
Oh, it's very important, and most patients, when they enter a hospital, they are assuming that the caregivers are doing the right things and following evidence-based practices. Yeah. And the Highmark Quality Blue program for hospitals actually helps to support the culture of quality so that organizations can implement practices that will assure that patients receive the right care at the right time.
You know, how old is this sort of, I'm going to call it a movement, it's probably, you'll correct me, it's not the right word, but this trend, about how old is this?
Well, we've been doing a pay performance program for hospitals since 2002. Not every health plan does that. Many have not even started in that realm. But we think it's very important to create a business case for quality for hospitals. Not that they don't want to do the right job, but we all know that if it's part of the importance for you to be successful as a business, that ups the ante a bit.
Yeah. Now, you're the guy, you see the patients, you're in the hospital, what has been the effect? I mean, do you have discussions of this with patients when they come in? I mean, what does this mean, like, to a typical patient out there who's watching our show? What does this mean to them?
Well, as Deb said, I think every patient expects that everything in the appropriate way will be done according to the evidence for a given aspect of care. And if you look at the tradition of the medical professions in nursing and medicine, there's a very rich tradition of quality improvement. Look at the technological advances over the past century as evidence of that. Having said that, we haven't always focused on re-engineering and redesigning the care processes that consistently deliver the high-level care to every patient every time. And I think that this movement, as you said, this emphasis on quality and patient safety is all about re-engineering and ensuring that the appropriate processes of care so that every patient, every time coming through a healthcare system receives the appropriate, safest care.
You know, I don't know, one of you, I'll let you decide who answers this. you know, there are some conditions, I think, medical conditions that maybe you see the consideration about preventative care more frequently than others. I mean, are there certain chronic medical conditions that come into play more often?
The Highmark program focuses on 3 or 4 different areas. The most important ones are preventing the spread of infections from one patient to another, MRSA in particular, and we'll talk more about that. Decreasing the rate at which people who have deep IV lines get infected from those. And then improving the frequency that every single thing is done exactly right for somebody that comes in with a heart attack or a stroke. And if somebody has a surgical procedure, doing everything that we know works to keep them from getting an infection after that surgical procedure.
Now, I'll ask you if you want to defer, that's fine. Staff. It's called hospital staff, for lack of a better word. You can explain this. This has been, you know, resistant, these infections resistant to sort of typical antibiotics, if that's a good way to put it. Is that one of the conditions that is center stage, so to speak, in this preventative care?
Right. That is exactly one of our core components of our Quality Blue program, and the intent of the program is to look and find out if a patient is a carrier of this staph.
Is that easy to find out?
Well, I'll let Dr. Caputo tell us if that's easy.
We want to go to a break. Is it easy?
It's relatively
But how about where you got it?
That may be a little bit more difficult to tell, but simply culturing the nose of a person, which is the usual place where one can find that organism being harbored, culturing the nose will tell whether the person is a carrier at that given
But
at
it
that
just
given
needs
point
to be
in time.
done. It's a procedure that needs to be
does,
done.
And that, again, has to be redesigned because the care process needs to be improved so that the patient coming into the hospital can be screened for the presence of that resistant staph. And then if that person is harboring that resistant strain, in order to prevent it from being spread throughout the hospital, they could be put in some special isolation precautions.
All right, our healthcare update. We'll continue with this discussion after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Dr. Madden, let's continue this discussion with the sort of health system acquired infections. I guess you can get these infections almost anywhere along the healthcare continuum in terms of what you think is being done and what needs to be done to be sure that this is one problem that we can get eliminated from the healthcare system.
MRSA is the infection we're talking about. It starts with a colonization on the skin, but then some people are colonized. We think about 1 in 6. If they acquire that while they're in the hospital, they get actually an infection from it. So what our program does, which this part of Pennsylvania leads the nation in attacking this problem, is screen people when they come in. If they have the colonization, they keep those patients isolated from others so they don't spread the colonization to them and keep them from getting infected. That requires resources. The hospitals have to culture people when they come into the hospital, which has never really been done before. But it's been demonstrated to decrease the rate that people get those infections. Other parts of the world have done this and dramatically improved their situation. We need to do the same.
Now, how does the Highmark program work in that regard? I mean, go ahead.
Right. We have 30 hospitals today in the program, and the hospitals are required to implement what Dr. Madden mentioned was the active surveillance testing. So the patient admitted to the hospital would have their nose swabbed to find out if they were actually a carrier of the infection or the actual bacteria. And if they were, then they would be appropriately isolated so they would not be placed in a room with a patient who maybe did not have that
Is
bacteria.
this pretty infectious, meaning it can spread pretty quickly?
It can spread quickly, Terry. And at Penn State Hershey, like all academic health centers, we're very interested in innovation, and we see this collaboration as a way to innovate. We've used this project to look carefully at our process of culturing. We've used some advanced technology to process those specimens, and we've begun to see reductions. So it's a very promising area, and it's already begun to show results.
How does this relate to Central Line Association?
Well, healthcare infections, as you mentioned, is a major issue, or a major issue for patients in hospital settings. And so some hospitalized patients need, instead of a small intravenous catheter in their hand or their arm, may need a larger catheter for intravenous fluids in their neck or their upper chest. And those types of catheters are more prone to get infected than others. And so another one of the components of this Highmark program is to build on that process of looking at how we can reduce further the risk of infection. And again, we've begun to see results.
Before I let you all go, look, doctor, a patient comes into a healthcare system, I don't care where it is there something they should be asking? I mean, if you're, you're a doctor, you're also a patient. You go in, is there something you're going to ask? I mean, is there something you can say, I think you need to do A, B, and C?
I think the most important thing patients can ask is everybody washing their hands before and after they encounter me?
How about wearing surgical gloves? We had someone on this program, and they said, I wouldn't want anybody touching me, just coming in. I don't care where you are. I mean, in what setting it is, whether you're in a hospital, you're in a doctor's office, am I dumb? Is that dumb?
No, but there's no clear advantage in most settings to adding gloves to the proper hand hygiene using...
So in other words, if they're doing the hand hygiene...
That should suffice in the vast majority of cases. It does suffice in the vast
unless
majority
they're doing
of
a
cases.
procedure.
Go ahead.
Yeah, unless they're doing a procedure, but they're coming in and taking your blood pressure or moving you in the bed or feeding you or something. Hand washing is very important and unfortunately not done every time and not done well. So that's the most important thing a consumer can do. Secondly, asking whether or not the hospital knows if your roommate has MRSA. I think that's an important thing to ask.
And that would be something that you wouldn't even think about asking, would you?
Yep.
Well, look, this has been a great update. And I think this is one of these kinds of programs that we do that's very, very important to consumers. I want to thank you for coming in. Financial literacy update. It's that time. We'll find out. We're going to turn to the financial side of things in a minute about make sure that when you're borrowing money, you're borrowing it wisely. That there's physical health, mental health, and there's also financial health. All right, we'll be back in a moment. Stay with us.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, it's financial literacy update time. Every month we get into some, we're not getting into your pocketbook. We're going to try to make sure you save money in your pocketbook. Joining me is Keith Welks. He's the Deputy Treasurer for Fiscal Operations for the State Treasurer of Pennsylvania, and Laurie Kennedy. She's a lawyer with the Pennsylvania Credit Union Association. She's Associate Counsel, in fact. Laurie, let me start with you. We've talked in the past about this Better Choices program that really you all created in the Credit Union Association to deal with predatory lending. Talk a little bit about predatory lending and why you felt the need to have a special program.
Sure, Terry. Predatory lending is a loan, well, in this particular case, it's payday lending, which are short-term revolving loans that carry high costs and fees with them. And basically what was happening to consumers is they were paying $10 to $15 per $100 that they borrowed on a 2-week basis. And a lot of times consumers can't pay that short-term loan off, so they end up paying additional fees to roll them over. The result of it is you get caught in a revolving cycle of debt, almost paying an APR of about 400% at the end of the day.
And there's been a lot of, really interest in this whole subject, I think, within the last year or two. And, the legislature and Congress, they've all been debating, these practices, I guess, within the lending community. Is your sense that, and we're going to get into the specifics of your program and the results, is your sense that sort of the corner has been turned on the whole payday lending problem, or do you think it's still a pretty serious problem?
No, we feel it's still a very serious problem, and we're committed to continuing our program to help more and more people in Pennsylvania get themselves out of this short-term revolving debt and into more traditional type of wealth-building programs, such as those offered by credit unions.
Yeah, Keith, I guess the economy, given how shaky it is and the attitude that a lot of folks have that we're in a recession and the credit card debt, all of that makes this more difficult, I think, for typical consumers. Is that what you're finding?
I think that's right. Certainly as the economy turns down, people that are particularly susceptible to payday lenders become even more vulnerable. The folks that payday lenders target are low-income working folks, military personnel, people who live paycheck to paycheck, those people who are finding it harder and harder to stretch their available dollars. And so payday lending becomes an even more intractable problem, if you would.
I mean, what inherent interest would the state treasury? I mean, I know your primary job, you get to collect the revenues from the state, write the checks that get spent. I mean, most of us know your general constitutional responsibilities. Let me put it that way. What is your specific sort of interest? I know this started with former State Treasurer Casey, this particular program. What's the Treasurer's Office interest in all of this?
This is actually quite a natural fit for us. The Treasurer Casey originally and now Treasurer Robin Weissman manages the Commonwealth's money. And both treasurers have a strong interest in helping everyday Pennsylvanians manage their money more effectively as well. And in particular, there has always been a concern in Treasury about that section of the population that's often characterized as being underbanked or underserved. People who do not have access to conventional, traditional banking services, like loans at fair and reasonable rates, like loans that can be repaid over time in installments, etc. We became involved in this 2.5 years ago when the magnitude of the payday lending problem became apparent to us, and we saw the opportunity to perhaps do something that would address that, and we found a great partner in the credit union.
And you made a sizable investment, right? I mean, investment of state money into this program, is that correct?
That's not precisely correct, and it's an important distinction.
Well, good. That's why I'm asking. I want to make sure you explain that.
Because we were so pleased with the way the credit union stepped up to address this problem and work with us in designing the Better Choice program so that it fit the needs of the borrower demographic we were dealing with, we wanted to signal our appreciation. So we actually have invested $20 million in a CD through the credit unions. But that money is not directly linked to the lending. But it's still an asset that adds to the base that the credit unions have to work with.
All right, we're going to run to a quick break. When we come back, I want to ask Laurie a little bit about, well, is this program working? Is it a success? We're going to find out after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy. And by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. We're doing our popular financial literacy update with the Pennsylvania Credit Union Association. Laurie, let's talk about this. Okay, you have this program. Keith just sort of got into the treasurer's involvement in the state treasurer's involvement in the program. Is it working?
Yes, thank you for asking, Terry. Actually,
that's the obvious question. Is the thing working?
We're very pleased with our first-year results. 2007 was the first full year of our credit unions offering the Better Choice program. During 2007, we had 45 credit unions actively making loans, and they made a total amount of $2.8 million in total loan volume, and we've saved consumers almost $2 million in 2007. So we feel that it is working. With the strong support of Treasury going forward, we hope to continue to be able to come back and bring you additional success stories, grow the program. We currently have now 65 credit unions signed up to offer the program.
So now let me get this straight. So, I mean, basically what would happen, someone, if they had a need to borrow money, they would go to a credit union, I presume, do a loan application, and how does it mechanically work?
Mechanically, we've tried to make it very similar to what you do when you go to a traditional payday lender. They would come into the credit union instead of going to the payday lender's office. The application process is very minimal. There's very little underwriting. They basically just let us know that they have a job, give us some verification of income. The maximum loan amount is $500. There's a $25 maximum application fee. Sometimes the fees are less. Sometimes the application fee is less in some instances. And different credit unions may put some different requirements on, but typically they can get a loan.
So this basically, Keith, is a program to, for small borrowing to get you over kind of a hurdle or some kind of temporary financial situation, right?
Absolutely. That's the reason it exists.
Yeah. Now, do you see any expanded role for Treasury in this? I mean, is this something that obviously you're paying attention to your investment, which we know the Treasury Department would do. Is there some additional role? I mean, you see this growing. I mean, what's your sense about that?
As Laurie said, there are a couple of things we hope to accomplish as we go forward. Number one, we want to continue to build the base, the footprint across Pennsylvania, so that it is ever more convenient for people to find an outlet, a credit union that offers this program. And I think there's a goal to get to 100 credit unions in the next year and perhaps get over 200 branch locations. So that's number one. Number two, we had as an objective, the credit union has an objective when we started this, increasing the relationship between the borrower and the credit union. So they were moving into more traditional, conventional banking services. They may, in fact, find that a regular loan is even cheaper than a better choice loan. So I think that the credit union and Treasury will be working to start to develop some empirical information that supports how that's working. Where it's not working, try and figure out what additional counseling we may offer. Those are key goals.
All right. Great update. Thanks for coming in. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.